can't function without less than 2 coffees a day. If anyone has any tips on how to slowly wean yourself off, that would be nice.
What is your favorite thing that you do for your patients?
Give them a mirror.
Or fixing somebody's smile, you are oftentimes tackling something that is a big insecurity. Good morning, you guys. Welcome back to my channel, and if you're new here, welcome. My name is Madina and I vlog my journey through dental school as well as some lifestyle and travel content. I thought I would start today's vlog while I'm getting ready this morning. I'm gonna head to school and study for 2 exams that we have coming up next week. And then in the evening, we actually have another dentist coming in to speak to us for the Aesthetic Society, which I'm really excited about. After Thanksgiving break, right before New Year's is a crazy time for everybody. I feel like just got back from break and you're just kind of in vacation mode. I know I definitely am after coming back from my trip. Now we have to get into exam mode. Pretty much a month left of school and then good for 2 weeks, and then we get right back into it. Just to let you guys know a little bit about the timeline at Columbia, for the first year and a half we are combined with the medical students for all of the lecture courses, and then we have additional dental lectures on top of the medical school courses right now. So at the moment we're finishing up endocrinology, and then the last medical block that we will ever have is actually called RMSK, and I'm not even sure what RMSK stands for, but that will be our last block, which will end this semester. Actually really excited because this will be the first semester in the spring where we only have dental classes going forward. So we will start our different dental specialties. So we'll start endodontics, prosthodontics, pediatrics. You know, although it's great to learn a lot of the medical material for us to be better physicians and for us to diagnose, alert our patients to certain issues, it is going to be really nice to finally start learning. Oh my gosh, my face looks crazy. It's gonna be nice to finally start learning material that we're actually going to use in everyday dental practice. It's not going to be very often that we're going to see patients with many of the conditions and diseases that we learned about in our med school courses. I just remember we did our oncology block not too long ago. I was so stressed out about memorizing all the different kinds of chemotherapy drugs and which ones to prescribe for which cancer, and then I was like, oh my gosh, I'm never gonna be the one that's prescribing chemotherapy drugs. I think it's absolutely worthwhile knowing what the drugs are and what their side effects are, because there are certain cancers and chemotherapies that can affect and actually cause osteonecrosis of the jaw, which is a crazy condition where you will actually have just breakdown of the jawbone, and so these patients have just like a devastating hit to their quality of life. It's so important to make sure to be able to monitor that. Also, I've actually seen this happen in an office that I worked at as an assistant. A patient was about to start chemotherapy and they had to come in and make sure that they didn't have any kind of like dental abscesses or infections, because those need to be treated before you start chemotherapy. Your immune system takes a hit when you are on chemotherapy, and therefore you need to be completely healthy, including your mouth, because yes, you guys, our oral health is just as important as our overall health because it's all connected. It is so hard to talk and do your makeup at the same time because it's hard to stay focused on one thing when you are doing something completely different. But anyway, I am a little bit stressed out just because we have so many things due in the next couple of weeks. Sort of like a research paper due for oral histology, where we read a newly published scientific article and talk about its relevance to our material that we learned in the course over the course of the semester. And that kind of has like a vague due date, but our professor just kind of said middle of December, and it is December 1st, and I'm kind of freaking out because I have so many exams coming up that I just want to get it out of the way. Then we have our actually oral path exam that is coming up next Tuesday, which I'm really nervous about because it's just so much information, which is all completely irrelevant, by the way. This is the class where we actually talk about the oral manifestations of all the diseases that we've been learning about, including cancers, fungal infections, bacterial infections, things like that. Any kind of anomaly that we see in the mouth, we have to learn for this class. So it's a lot of images. We all obviously talk about how they present in the mouth, but also other systemic symptoms and what you would see on blood work and who you would have to refer to in these situations. So it's an extremely important class, but there's just so much information that most of it was taught through these like online modules that have somehow disappeared. Something happened with our school where we had 2 courses. The course videos that are basically teaching us material that we have to know because it's not enough lecture time to be able to teach us all of it. We basically have to use pared down notes of people who had managed to watch all of them before they disappeared, which was almost a month ago now. We do have a lot of resources and our professors are really understanding. It has been really frustrating to have to deal with that right before final exams. This happened with our oral histology class and it also happened with oral path. So the videos are still not back up. It's really stressful because our entire grade is based off of this one test. Just, it's a lot of pressure on one exam. But aside from that, I also need to study for our endo class. And I'm actually happy that we're taking endocrinology right now because that is one of the few classes that I actually did take in undergrad. I have a little bit of background on it that I really did enjoy. It was like an upper level bio elective that I took my senior year of college. The professor was really great in undergrad too, and I think he was one of the people that actually wrote one of my recommendations for my application to dental school. I really feel like I learned a lot in that course. Obviously what we're doing right now is much more in-depth, but at least I'm happy to know the basis of a lot of the hormones, like where they're made and how they work. Okay, I think I'm done getting ready. I'm gonna head to school and check in with you guys in a little bit.
Oh my god, it is so cold outside. It is now like 4 p.m. I've been at school so far for like 4 hours just cranking out World Path lectures. But I just stepped out to get my second coffee of the day because I'm gonna be here for a little while longer for the Dr. Dean event. So I want to be alert and be able to pay attention. It's later in the day. Just cramming information in your brain for a while, you know, you get tired. I'm heading off to grab a coffee and maybe change my study environment a little bit because the floor that I was sitting on got pretty loud, and although I usually don't mind that, I like background noise, there was just like a group of like 3 people that were just super noisy, so I think I'm gonna go to a different floor once I get back. Alrighty, so I found a much quieter room. I can't study in like complete silence. I actually tend to like distract myself when there's no background noise. Gave myself an excuse to get outside and grab a coffee and then find another place to study. If I ever had to go without like caffeine, I think I would slowly fall into a depression. Can't survive without it. Like I was on vacation and I didn't really feel the need to get coffee because it was like waking up early in the morning, but I was getting plenty of sleep, so it wasn't like I was tired. And if I wanted to nap, I could take a nap in the middle of the day. In the second half of the week, we stayed at a hotel that had like breakfast included, and so they had like an iced latte on the menu. But the thing is, like the iced latte that they made was just like so much milk and water that you couldn't even taste the coffee. So I was just like, might as well not even be drinking coffee. It was fine, but it is, but just like being back home and like being in an academic environment, as soon as I'm back, I'm waking up early, but I'm still getting enough sleep. I can't function without less than 2 coffees a day. If anyone has any tips on how to slowly wean yourself off, that would be nice. And the thing is, like, I actually like coffee. Like, I don't purely do it for the caffeine. So people that are like, oh, you can just drink like an energy drink or like 5-hour energy, like, no, I don't like those. Those actually make me jittery. I actually like coffee for the taste and for the energy. So it's like a nice little, you know, synergy. I'm talking too much. This is just a way to distract myself from, what am I doing? Oral manifestations of hematological disorders, which is just a long-winded way of saying if you have something wrong with your blood, you would be able to see it in your mouth. Honestly, I really like Oral Path. I think that it's one of the most clinically relevant classes that we have. It's just so much information, and it's the whole thing with the videos being missing that I told you guys about this morning. It's been frustrating, but it's okay. We're grinding it out, we're getting through it. It's gonna be fine. It's gonna be fine. It's gonna be fine. I'm manifesting a good grade on this exam, or at least a 70. That's what I need to pass. But we're manifesting for next week. Fingers crossed.
What are you using? I don't know what you're using for crowns in the clinic. Try to go, not really smiling big, can't really see the teeth. Okay, that's Robert.
Canted?
Not good, not good. Back torso, close down, slide right. I just went, stop, no, slow. No good, no good, no good. That's no good. I found the best.
Who did you? We have Dr. Dean here. He did
Hi,
just
guys.
an amazing lecture. We learned so much, so many pearls of wisdom. You guys should follow him on Instagram. I'll drop the social down below. I always ask this of all of our speakers that have come for events. First question is, what is your best piece of advice for aspiring dentists?
My best piece of advice is don't sign a contract for 3 years. Sign it for 1 year and only work 3 days. The other day, you get a job learning. The second day, you get a job building your practice and yourself. And the 5th day, you actually listen to CE courses and grow yourself. For the next 4 or 5 years after school, you have to take CE courses to get your hands and your eyes and your techniques really honed in so you can become the best dentist you can.
And what's something that you wish you did in dental school that we have access to now?
You have access to digital technology. I would be on the internet learning about digital technology. I would find mentors. I didn't have really good mentors. In the beginning I did a little bit, but now you have much more access to the great dentists in the world. And I think the social media is amazing to get connected with people that you could never really access, and you have that now. So that would be the 3 things that I would tell you.
And the last question is, what is your favorite thing that you do for your patients?
Give them a mirror.
Yeah, your work speaks for itself.
Good
Definitely.
To see you guys.
Thank you so much.
So I got home a little while ago, but I just wanted to give my thoughts on the Dr. Dean talk. I gotta say, so much perspective that I got from listening to him. I think because of the years of experience and his particular teaching methods, Dr. Dean just has a way with words and how he kind of led the talk and kept a very engaging lecture. He joked a lot and really tested our knowledge as dental students. Frankly, was a little bit embarrassed that I didn't know some of the questions that he was asking, but I will remember now for the future. I have followed his program FMR and him personally for a while. When I would look at his cases, I would think, wow, that's so amazing. But when he actually broke down the thought process of what goes into every single case, the painstaking steps that he takes, and how his approach is so completely different than what I see and what a majority of people do, is incredible to me. Because the approach to cosmetic dentistry is not purely aesthetic. The main considerations, because he's a prosthodontist, come from that perspective. Function, occlusion. Occlusion, for those of you who aren't unfamiliar with the term, is how your teeth come together when you're biting. Some of the things that he talked about, I had completely never thought about and would never think about in the way that he described. Listening to his lecture really solidified something for me. I had been kind of thinking about and have been on the fence for a while. 1000% want to learn from somebody like that. Part of Dr. Dean's forte is that not only is he a practicing prosthodontist, he actually loves teaching. Definitely think that as soon as I'm able and as soon as I graduate and finish residency, invest in taking his occlusion course. It's so important, regardless of what kind of dentistry you practice, to approach it from the perspective of function. If you just approach it from the aesthetic standpoint, a lot of dentists can make veneers that look nice, but to make veneers that last and don't get knocked out and chipped in a couple of years because of the way that the patient is biting, to not give a patient headaches and jaw problems because their teeth aren't coming together in the right way, even though they may look great, all those things are not things that patients will necessarily notice, but they're things that I would pride myself on being able to do and deliver that kind of care to my patients. He honestly gave us so much advice just how to deal with patient interactions, because when you are fixing somebody's smile, you are oftentimes tackling something that is a big insecurity for a lot of people. He showed us these before and after photos of these incredible, full mouth reconstruction cases, and you could quite literally see the difference in the confidence between the before and the after. And obviously you have to get a smiling photo, because one of the ways that you can see how the teeth sit inside a person's mouth. So if you look like this, it's different than them just smiling like this. You want to see how people's teeth sit in their face. And you could literally see the difference in how good a person felt in the smile that they had in the befores and the afters. And honestly, that is something that I wrote a part of my personal statement about, thing that made me fall in love with dentistry. It is something that is so significant to so many people, and you have no idea how many people talk like this, or when they smile they do this because they're so insecure about their teeth. It is something that can completely transform how a person feels about themselves and how they interact with others and how they present themselves. I thought I was a crazy person when I would meet a person and immediately my eye just goes to their teeth. He actually said to us, in restaurants, he notices like when a person's chewing in a weird way, it's because they have an ill-fitting denture or because their occlusion is off. He shamelessly comes up to people and says, like, I noticed that you're having trouble eating, I'm a dentist, I can maybe help you out. And he just hands out a business card. I honestly think that, first of all, you have to have the guts to be able to come up to a person and do that. Second of all, that is probably a fantastic way to get patients. Almost like magic that you can see without even speaking to a person. You could just look at them and see how they eat in a restaurant, how they speak. My dog decided to run up to me. Hey, Teddy. Hey. Anyway, I just thought that was the most brilliant thing. The other thing that really stood out to me about his talk was similar to what I said in the last vlog about Dr. Alex and Dr. Shannon's talks. He said that he heard at a commencement speech of a dental school, if you look around, all these people are now your competition. And he said that, he thought that that was absolutely crazy. This is not about competition. This shouldn't be about competition. This should be about collaboration. I can't treat patients in all the surrounding states of New York, but I can teach someone to go treat patients in New Jersey, to go treat patients in Connecticut, etc. because I have a
skill and I just want to share it with other people because we can all succeed. Even though there are a lot of dentists per capita, especially in a place like New York, everyone's got something different to offer, and every patient needs to find the doctor that they click with and also provides the type of care that they're looking for and the budget that they're looking for. He actually talks about the fact that these full mouth reconstruction cases tend to be very, very expensive. Even though a person may not be able to afford it, he still works with them. You know, he asks them what their budget is. You know, say they have like a $70,000 case, which a lot of times with a full mouth reconstruction case can happen because you're doing so much different work. It has to be done over a period of time. You work with them and meet their goals regardless of what the budget is. Things that he kind of highlights and says that are important are clearly things that he learned from trial and error and years of trial and error. He is definitely someone that I am so happy that we have access to. He's so open also. He was like, my door's open anytime, feel free to come by. I have so many students shadowing all the time. Honestly, again, like I said in the last vlog, that is one of the highly underrated things about going to school in a big city. Even though it's more expensive, it's the people that you have access to while you're in school, to network, to build connections, and most importantly to learn from. My very long-winded recap of the Dr. Dean event. It was again such an honor to learn from him, and I hope that you guys also got some pearls of wisdom. Kind of funny, I wanted to kind of save him some time, and I said, can I ask you one question? And he was like, no, one question is dumb, let's do 3 questions. I was like, absolutely, I will ask you as many questions as you will possibly have time for, and as long as we keep having the events, I'll keep doing it because I enjoy it just as much as hopefully you guys enjoy watching it. So I'm gonna end today's vlog right here.